If every step feels like a struggle, you're not alone. For millions living with neuropathy or osteoarthritis, even short walks can be exhausting and traditional treatments often fall short. At NexGenEsis Healthcare, Dr. Abhishek Reddy and Dr. Joe Furman take a different route, focusing on helping the body to repair itself. I spoke with one of their patients, Sammy, who finally found lasting relief after trying everything else. Sammy, you've been having problems with osteoarthritis for a long time.
Yes.
What was happening?
Oh, when I was in my 30s, that's a long time ago, I was diagnosed with osteoarthritis. They took an x-ray of my back, and they could see that I was going to have it a lot in the future. I didn't want to just mask the pain. I wanted to try to find something that would like hopefully cure it, and someday I figured it would just happen.
Yeah, but you were buying lots of things that just weren't working.
I would see stuff on TV or in a magazine or whatever. I'd try it.
How did having this osteoarthritis impact your life?
You have to deal with pain all the time, and sometimes it's not as bad, sometimes it's really bad. Sometimes I had to stay home from work because I couldn't move.
And then you found NexGenEsis, and what happened?
I found NexGenEsis about a year and a half ago, looking at a commercial on your show, and I just started thinking. I researched it a little bit. I said, "This is it. This is for me," and because they use your own body to cure you.
And how do you feel today?
I feel wonderful. I can get in and out of my car with ease. I can walk all over the place. Don't even think about my knees like I would, because I don't have the pain anymore.
Dr. Reddy, one of the most common reasons for joint pain for a lot of people is osteoarthritis, and if you ignore it, it doesn't get better.
Yeah, that's true. So a lot of patients that come and see us are coming in with mobility issues, pain due to osteoarthritis, as you mentioned. That's really that breakdown of that joint space, that wear and tear that kind of happens over time, and it really causes a lot of quality of life issues for some of our patients.
Yeah, when they're sitting in the chair talking to you, you'll hear a lot of them go over their stories of if it feels like it's bone on bone, that's because it is bone on bone.
Yeah, that's true. And here at NexGenEsis, we offer a lot of treatment options for patients that come in with osteoarthritis to really help to restore some of that quality of life.
Yeah, y'all might not be the first stop. A lot of times they've tried steroid shots. They were told that surgery was their only option, and you want them to know that there is a better way of helping the body help itself.
Yeah, so a lot of times patients will come in, they've been offered surgery, they've tried steroid injections in the past, gel injections, medications, and different types of therapies. We offer an alternative solution with little to no downtime. The recovery is much quicker than having surgery done, and we can really put the body in a good position to heal itself.
Yeah. How does the body heal itself? It was basically kind of made to do that, wasn't it?
It was, yeah. And what we actually do is we actually extract like healthy cells, growth factors, molecules, and we reintroduce them into the affected areas and really promote that healing environment.
Yeah, and we say promote that healing environment. You're getting to the cause, the root of the cause, as opposed to treating all the symptoms around it.
That is true, yeah. So, we like to allow the body to, as I mentioned, to heal itself, and rather than actually just symptomatic treatment or a Band-Aid, this kind of actually helps to restore some of that function.
Yeah, all right. When it comes to, Dr. Furman, when it comes to neuropathy, so many people are being treated through that whole thing of the symptoms. And they feel like if the symptom went away, then the problem went away. Right. No, neuropathy is also one of those things that just marches on and gets worse if you don't arrest it.
Correct, yeah, and it's one of those progressive conditions, right? It gets worse over time, as you were just saying. Things like gabapentin, Lyrica that are commonly prescribed to these patients, they don't fix the problem, right? They may reduce some of the symptoms. It comes with side effects, of course, but it's not fixing the internal issue.
Yeah, and treating neuropathy is personal for you.
Yes, absolutely, it is. And unfortunately, my grandmother had diabetic neuropathy. She did have to have an amputation of her foot, ended up taking her entire leg. So I was able to see firsthand how this can affect people and their quality of life going forward.
Yeah, diabetes is one of the most common reasons that someone might have neuropathy. But let's go through some of the symptoms right now, because I know someone watching may be in the early stages of it. And it's easy to kind of dismiss those sure. early symptoms.
Absolutely. So things like numbness, tingling, burning in the feet, legs, or even the hands. Balance issues are also very common. So, people stepping off curbs or stepping onto stairs, if they're tripping and falling, these things can be caused from nerve damage in those areas.
Yeah. And again, you're helping the body to help itself.
That's right. Yeah. So just like Dr. Reddy was saying, putting the body in the best position to heal itself, using lots of different treatment methods, such as things like acoustic compression, laser treatments. We offer supplementation. So lots of things to heal the body.
Yeah. And the goal is to stop the progression, reverse the symptoms and restore that sensation and that stability, because as we know, this is something that somebody can end up in a wheelchair. They can end up with, as you mentioned, amputations.
That's right.
Even getting out of the bed in the morning, tripping and falling because they have a numb foot, and that leads to other issues as well.
Definitely.
Bottom line is, a lot of us just we try all the common things, but we have to find the solution. And what you all want to work on is the body and the solution, not treating the symptoms.
That's correct.
That's correct.
All right,
Yes.
gentlemen, thank you very much.
Yep.
Thank you.
The first 50 callers to mention Great Day Houston will get a complimentary phone consultation with a NexGenEsis patient care coordinator to see if you're a good candidate to come in for an exam. The number to call, 832-570-4529. Again, that's 832-570-4529. To learn more, visit NexGenEsis Healthcare.